Chiking aluli, bawani kamarka, yabu chikin sarki, ka isa daw kaka, kanay nayukang mama. No other name like the name of Jesus. No other name like the name of the Lord. No other name like the name of Jesus. Is worthy of, is worthy of, is worthy of and praise. Hallelujah. Father, I give this program to you. Take it. In Jesus' mighty name we pray. Amen. You know, there are some people from one state. Their keyboard doesn't have T. I say street. The hell workers, they don't put T. I'm not a hell worker. We're health workers. Correct, perfect. All right. So we're going to briefly talk about. Don't be putting my picture, put that thing constantly, please. I know that you are doing media. Don't do media. This one is training. Don't put my picture. Put the slides throughout. Please. Did you hear? I don't want to be saying put on slide, put on slide. Did you hear what I said? Media. Put the slides throughout. Thank you. God bless you. So we're going to briefly, this training is supposed to take 2 days. That's why I'm rushing. So this, if we want to really do the correct thing, it's 2 days. Yes. So this one we're just scratching. Did you hear what I said? Scratching. Because if you don't do it well, there's no need for the training. Because you will just be doing motions and there's no need to do it if you don't do it well. Am I communicating? Right. So, next slide. We know that in the beginning, there was life, isn't it? And that life was with God. And that life was what? That life was God. Because God breathed his life into man, and man became a living being. But after the fall, death came. And that's why we're doing this, isn't it? Because man perverted the law of God, and death came. And next slide, please. And then we know that man is made of body, soul, and spirit. But today we are going to talk about the body, okay? Next slide. Last year, the theme for the World Anesthesia Day was restarting a heart. Restarting a heart. As I mentioned on Sunday, some of my colleagues did this training at Fatima Church, Catholic Church. Do you know that the very next week, the person that invited them, his wife, had cardiac arrest. And he was able to revive the wife. So he called and he said he never knew, he was calling it, he never knew the thing would come close to his house. Just within the week, it happened. His wife had cardiac arrest. So we try to preach the gospel of BLS, to mosques, churches. I've been to the Nigerian army. I've been to road safety and many other places. So nowadays, this is what happens. If some people will remember, I don't remember the year. She was a director in the ministry. There was an accident on Wednesday at that place, this road near Stanel. There was an accident there. A tipper fell on a vehicle. Some people might have, I was leading Wednesday prayer here. There were no people. So I was wondering what was happening. It's later on. For 1 hour, that woman was crying until she died. That shouldn't be. It should never happen. People will be snapping and say you're a relative and be putting on Facebook. That is demonic. Now, brief history. In the past, we had various, things that people do. People use heat. People use smoke. People use cold. People use beating. But most commonly here is water, isn't it? If somebody collapses, it's water that we use. And there are extreme things like suspending somebody on a rope. So the issue, even as our speaker yesterday said, the next slide, the issue is that time is of the essence. Time is of the essence. Because between 3 minutes, maximum 5 minutes, the brain will die. So even when you revive the person, you become a vegetable. You will not recognize anybody who just, all right? So that is what happens. So we have to revive and recognize cardiac arrest very fast. And for laymen, once somebody is unresponsive, once somebody is unresponsive, is cardiac arrest. Did you hear what I said? Unresponsive. Don't go and be checking for pulse. It's not because you will make mistake. So usually, are you okay? Are you okay? Is not responding. Are you okay? So you start resuscitating straight. Once is what? Unresponsive, start resuscitating. All right? Are we together? So, because if I begin to say you check the carotid pulse, you check which pulse, there'll be confusion. I assume that I'm talking to, in quotes, laymen. I know that there are medical people here. So, what is the chain of survival? Leave that one, the chain of survival. Of course, you can see telephone. Do you know that, I think, 2021, Japan supplied over 500 ambulances to be used in Nigeria. But up till now, nothing has happened. So that telephone, go work. There's nothing like 911, all those numbers are 999. Nigeria's number is 999, but there's nothing like that. If you're in trouble, I call 999. You see nobody. All right? So that telephone is not there. So the only next chain of survival is your resuscitation, which is what they're talking about. Isn't it? Defibrillator, of course, even hospitals are supposed to have. We rarely have defibrillators. That's the third one. Then, of course, the fourth one is to take the person to the hospital. So between that cardiac arrest and that fourth one, mostly they'll say they brought the patient dead. That's what they brought the patient dead. Because there was no resuscitation. You know the Baba that sings, Jimmy Swaggart? 90 years, but he was resuscitated. He died several weeks after the cardiac arrest. But at 90 years, they still resuscitated him. When he collapsed. The children, they're not medical people. So that's why we need to know this. Am I communicating? Right. Our ambulances, unfortunately, they're used for carrying corpses. When they come to youth, they'll be telling the CMD that new ambulance, that one, and that's the one that has equipment for resuscitation. That's the one they want to use to carry their dead body. Then they will leave us with the one that is not good to resuscitate patient. I'm preaching something so that you don't come and tell CMD to give you that new ambulance. Eh? Am I communicating? May the Lord help us. So, this is a brief. We are going to concentrate on the lower one. This is a brief scheme of events, all right? The number one is recognition and activation of emergency response system. Number one. So usually, if it's in an open place and you recognize that somebody is unresponsive, you call for help. All right? I'm going to be repeating this several times. You call for help. Actually, they say you shout for help. It's not just calling. You shout for help. And say, somebody has had cardiac arrest, please help. That's what I'm supposed to. But not to carry phone and be videoing and be putting on Facebook. Call for help. Say somebody has had cardiac arrest. But if you just shout without saying anything, people will be confused. You know why in Jos? That's Amfara. So if you shout, say why you're shouting. Somebody has cardiac arrest. Am I communicating? So that's what you do. And then, of course, the next thing is immediately start CPR. So the Americans, there are different protocols, but mostly the Americans say go straight and start the cardiac massage. And then you go to the airway and then you give your breaths, which I will demonstrate, okay? Then, as you call for help, somebody should assist you. Because if you are really doing that thing very well, I'm telling you, within 5 minutes, you'll be very tired. If you are doing it well, within 5 minutes, you'll be very tired. So, you will also call for a defibrillator. And unfortunately, Reverend is not here. We must buy that thing. This is mini Equa Plateau Church members meeting. Let's vote. Who wants us to buy AED? So, AED is the defibrillator. The one that you see in film, they do, and the person will do that thing. It's very important. The earlier you do that thing, it also revives. So the community around here will gain, because they will say, somebody has cardiac arrest, even if he's not a member, will say, go to Plateau Church, they have AED. They will carry it, and we'll talk about that. Because the AED, why it's called AEDs, is meant for laymen. The only thing that you need to understand English, because it's not in Birom, neither is it in Yoruba. It's in English. It will give you instruction on what to do. And the earlier you do that, it revives people. The survival rate increases from 5% sometimes to 60% and even above. The earlier you use the defibrillator. So the elders that are here, tell the reverend, me, I'm not elder, let me bring the thing. Let's buy AED and keep in the church. Are we there? So from there, of course, you call the ambulance service, and then ambulance service. And so if we have this system, less people will be having issues, okay? We don't have data much, but in America, they say they have between 700,000 to 1.2 million deaths from cardiac arrest. Cardiac arrest is sudden cessation of the activity of the heart. You are not expecting it. It's not because somebody that is very sick, having cancer, you are expecting that he may have. But I'm talking about unexpected cardiac arrest. They are between up to 1 million. People are just dying suddenly. All right? So that is what happens. Next slide. So for the compression to be effective, because I'm not talking to medical staff, because if I begin to say the nitty-gritty now, so usually just put an imaginary line across the nipples if it's a male. But if it's a female, just go to the middle of the chest. Usually I'm supposed to go slightly down. Just slightly down, 1 finger breadth, slightly down. But for us here, if you go to the middle, nothing will happen. This is not an academic thing. I don't know whether there are people that will start bringing academics here. No academics. Go to the middle of the chest. Did you hear what I said? Go to the middle of the chest. And, I've been doing this for long. This is the first time my wife is attending. So if I collapse, I'll have trouble. All right, Karikidamu, I didn't seek permission from you. So you go there. This is how you do your hand. It's the heel of your hand you use. The heel of your hand. If it's in resuscitation, let me just give something. Write it because you might not. In resuscitation, we have definition. It's not the normal definition. All right? If you have a child that is below 1 month, 30 days, it's called a neonate. Mostly, that one is called a neonate. Then, if it's between above 30 days to 1 year, it's an infant. That's the definition as per what they call it, as per our classification for BLS. Then between that 1 year to 8 years, we call those ones child. Do you understand? Because the resuscitation is slightly different. Then from above 8 years, we treat them as adults. So sometimes it's a child that you don't know. So if you find a child, if it's a female and you don't know the age, the child has already developed breast. You treat him as an adult. If it's a male, and he has pubic hair, you treat him as an adult. That means you're assuming that he might be 6 years old, but I'm just saying you just use the resuscitation guidelines for that of adults. And then those, I'm going to show it for those smaller children, those neonates and infants, either use 2 fingers or use the hand encircling system, which I will show you because I will repeat this 3-4 times so that it will stick before we start. All right? Then, if it's a child that is between above 1 year to about 8 years, that one use 1 hand. 1 hand is the heel of 1 hand. Then, of course, from above, you use 2 hands. Are we together? So what you are doing, if you can see that picture, you are squeezing blood out of the heart because the heart is no more pumping. As you squeeze, blood will flow. As you release your hand, it will draw blood into the heart. So that's why you don't put your hand there and leave it. You do and remove so that blood will flow back. Then you press again. So it's like you're pumping. Do you understand? That's what you're doing. All right? Next slide. Next slide. So generally, the recommendation is that you should do at least 100 per minute. That's those compressions. So it must be very fast. 100, maximum 120. So if you are doing 120 per minute, I know that there are only 60 seconds in a minute. That means every half second. So when you look at the TV, sometimes you see someone doing, it's not correct. It's supposed to be wah, 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 every half second. If you want to do it effectively, every half second. That's why I'm telling you that within 5 minutes, 2 minutes, you'll be exhausted. If you are really doing the correct thing. Am I communicating? So every half second, you are compressing. And the compression must be adequate. So my mom, they are used to inches. So you are talking about 2.4 inches depth. We were talking about 6 centimeters or thereabout. Do you understand the depth for an adult? But the most important thing is that at least you should go 1/3 of the anterior-posterior diameter. Do you understand what I said? The distance between the chest bone and the backbone. You should go at least 1/3 the depth of your compression. Is it clear? If you remember that, you don't have to remember 2.4 centimeters or 6 centimeters. Have I communicated? Did you get that one? You didn't get it? Huh? I said the distance, they call it anterior-posterior. The distance between your chest bone and the backbone. If you are compressing, the depth should go at least 1/3 of that distance. 1/3 of that distance. 1/3 of the anterior-posterior distance. Am I communicating? Yes. Huh? For you now, I can guess. No. Isiba, that's what I'm saying. 1/3 is 1/3 of that distance. Of that distance between here and there. 1/3 of that distance. Is it clear? Is it clear? So for you, don't remember the centimeters. No, that is the approximate distance. But you know that a child, for example, a child of 1 year and a child of 7 years, they are different. So you can't be talking of centimeters. So that's why that 1/3 is better. I don't know how to. Okay, Elijah, come. Standing this way, so that I'm talking of the distance between these bones. Huh? 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 6 centimeters. 6 centimeters is like 3 of your fingers. Like this. But that is not what I'm not trying to say. As I compress, go the depth to 1/3 of the distance between the bones. Because if it's a child of 1 year, it will be different. The force I will use is different to the force I will use for 7 years. But all I want to achieve is at least I should go 1/3. The mannequin, they have a fixed plan to indicate the distance. Human beings do not have a fixed plan. So you are going to estimate by using the mannequin, not with the let me say it now. But somebody asked that what is the I see that And then with the advent of some of these, is it on? Some of these people, you don't even need to to do any resuscitation because they're already high on those things. I know it depresses the respiration. So the cardiac arrest came as a result of depression of respiration. There's no oxygen. They're not breathing. The heart will stop. So some of them, if you have naloxone and you just give them few, it will clear the overdose of that drug they've taken. And they will wake up. In 2015 or so, was it 2014? I don't know what I've said it here. A 13-year-old girl from Bokos, she left Bokos and came to Angwan. Not Angwan Shetan, sir. Congo Russia. Congo Russia, the Koro Road that joins Congo Russia and Bauchi Road. When you go there is no Muslim, there's no Christian, they are just together. This girl would take diazepam, that's volume 20. Me, if I take 5-1, I'll wake up 1 p.m. the next day. Or this girl would take 20, 13-year-old. They were in a small room and there are about 6 of them. So, let's leave that one. So, that is that. So, that naloxone, it also helps because of the thing. So, I'm repeating again, Dr. Cap. Dr. Cap. Let me off this one so that it will not be. Well. So, Dr. Cap, this one, the Dr. Cap is for emergencies. The D is danger. I was in Rukuba Road, and you know how they build houses? They'll do it 4 corner like this, and they'll be inside chicken gida. Do you understand? And then the electricity was connected between the different rooms. So unfortunately, it was just hanging near the zinc. So slowly, as wind was blowing, it was chopping off the elastic or whatever they call it. I'm not an engineer. There was insulator. So somebody came and hung his, after washing, he hung his wet clothes on it. So of course, bzzz, hey, bzzz, 2 people. Yes. So that's why that D is very important. You have to look for your own safety first. That's the D. Check for danger. Check for safety. You can't rush to go and help, and then you become a casualty. Am I communicating? So you must do that. You must do that check first. What is it that caused this person to collapse? So don't just rush and go and say you're helping. Because 2 people collapsed that day. Bzz, both of them. Even, I think 2 years ago, there was one high current in Gadabu, if you remember, 2 years ago. The same thing happened. One family like that, the boy was inside, he opened the fridge also. Bzz. Then the senior sister, bzz, they both died. You remember that story? Just about 2 years ago. So let's be careful. So that's the D. Then, of course, the responsiveness. I told you I'll repeat this in about 3-4 times so that it will sink and enter. So you check for responsiveness. And that responsiveness, you become my... So the responsiveness is not Elijah. Let's say he's high on drugs. Will he wake up? So he has to be vigorous. And you have to shout. Because first of all, you shout, especially if you don't know his name. Say, sir, are you okay? Ma, are you okay? He's shouting. He's not just talking normal. That's for the responsiveness. And if he doesn't, then you shake him vigorously. Not soft. It's not soft. Am I communicating? So that's how you check for the responsiveness. Then from there, we go to cardiac compression. Cardiac compression. And the cardiac compression, I remember I told you that 100 to 120. But what you do is you don't do it continuously. You do 30. 30 compressions. Then you do rescue breath, 2. So you do a cycle of 32, 32. So within 2 minutes, you should have done more than 5 cycles of 32. Do you understand? Because in 2 minutes, you're supposed to have done 200. That's much. That's because these things is not, I had one mason just to build gutter for water to flow. He's measuring it with his eyes. And I got out the ido so that when he finishes and the water is still there, I had to shout. I said, sir, you have a plumb and you're not using it. So what I'm trying to say is that this 200 is not, they didn't imagine it like that plumb, like that mason. No. They've experimented and have done experiment and show that it's more effective to do it that way. So we're not recommending things that have not been tested. Because initially it used to be lower, but they now discover the faster, the better the outcome. Am I communicating? All right. So at least you should do more than 5 rounds, 5 to 6 rounds within 2 minutes. So if you have somebody that will help you, then you will do the 30. The person will give the rescue breaths. You do the 30. The person will do the. So after you finish that cycle of 2 minutes, you will exchange. And you will not exchange in a way that you are going around the legs, because minimum interruption should be done. The interruption should not be more than 10 seconds. So if one is here doing this, you are here. Am I communicating? So when it's 2 minutes, this one that was doing the rescue breath will come to this side, not to come to this side. He will come to the left side. Then you, who is supposed to do rescue breath, will come to the head. Then you do 2 minutes. Then you keep 2 minutes. Am I communicating? Because if you want to go around the legs, it will take more than 10 seconds. Am I communicating? So that's how it is. So rescue breaths. So, but the initial time you check airway first before you give the rescue breath, because there might be something that maybe it's dentures that has blocked the air. Do you understand? You remove the denture or anything, whatever it is, you do that before you now do the breathing. That's why it's called DR cap. All right. So this is details. It will be given to you. Next slide, please. Sorry. It's just repetition. This one is just repetition. It's there. It's going to be given to you. Okay. Next slide. All right. It's small, but I've said almost everything. Okay. Next slide. So this slide, sometimes you are afraid to do mouth to mouth because you're afraid of infection and all that. Although they've said they've not recorded any of such. But if you are afraid, you can do that. If you witness the collapse, if the person falls in front of you, that's witnessing it. Cover, lawyer.
So if you witness it, you can do compression only, but that one is only for 5 minutes, because within 5 minutes, the oxygen that was in the system would have disappeared. Did you understand what I said? Did you get what I said? Okay. If the person collapses in front of you, it's called witness. You witnessed the collapse. So that one, if you're afraid to do rescue breaths, you do compression only. That means you just continue compression without rescue breaths. Just continue your compression continuously. But the effectiveness of it is, after 5 minutes, no more effective, because the oxygen must have been used up. Is it clear what I said? Is it clear? Well, next slide. So, last week, that's when I started hearing federal government saying they should ensure that their AED, the full meaning is automated external defibrillator. It's not automatic. It's not electrical. No, automated external defibrillator. Is, and as I said, if you know English, you can use it. It's not evil. So, if you are in the airport or abroad, because I don't know when it will come to Nigeria, and you see this signage, if somebody says, help, help, somebody has collapsed, just look for this sign. Once you see it, rush, go and pick it and bring it. Did you hear what I said? Remember this sign very well. It's not thunder. It is AED. And we will do it also and keep it somewhere at the corner, and we'll put this sign by the grace of God. Amen. Yes, sir. We can do it. So you rush, go and bring it. So you don't stop the resuscitation because there's AED. What you do is keep doing your resuscitation. When the person brings the AED, he will attach the AED. On the parts, I will show you, on the parts is the drawing is there where you place the part. But generally, you place it below the right clavicle and below the left breast. Okay, now? Because if I begin to talk of mid-clavicular line and some funny things, we shall be confused. But we don't serve a God of confusion. So below the what? The right clavicle, below the So this is how this one places it anyway, but whatever it is, this is how it is. Because they will always draw it. So that patch is what we call the pad, P-A-D. Pad. You know pad that women use. We also call it pad. Remember those other ones that have something like this? Those ones are called paddles, not pad. They're called paddles. But this one, pad, you place it there. So, but if there are two, the other person will continue. As the other person is putting that part, you shouldn't stop. You continue. So usually when you bring the AED, you put it on, but some of them, once you open it, it will come on. Then when it comes on, it will now tell you, attach the parts to the AED. Then you will attach it. Then you will say, attach the parts to the bare chest. All right? So sometimes it might be somebody that is hairy, it will not work. So ideally, we are supposed to buy many parts. So because there's no time to say I'm going to shift, you put the parts on the area and avoid the hair. Then you clean and then put a new one. Do you understand? Because there's no time you say I'm going to shift. It's not going to work. So the place must be dry. You must clean. And you must remove the shirt. So because it will tell you, put the parts on patient's bare chest. Then you put it on patient's bare chest. Then it will tell you, do not touch the patient. That's when you stop the resuscitation. Do not stop resuscitation when the AED comes. It is the AED that will tell you to stop resuscitation. It will tell you, do not touch the patient. Then you stop. Is that clear? When you stop, it will now say analyzing rhythm. It's analyzing the heart rhythm. There are 4, and let me not go into that. Just confused. Because it's automated, it will tell you, it will make the diagnosis. It will read the ECG of the patient and give the diagnosis. That's why it's automated. Let me not go into that because this is not. So it will give you the diagnosis. And when it gives you the diagnosis, it will tell you shock advised, charging. So it will start charging by itself. You know, the other one that paddles, we're the ones that set it by ourselves. It will say charging. Stay clear of patient. Do not touch the patient. Press the red button. So you now press, bang, the patient will do jiggy jiggy. But what if you are doing jiggy jiggy and you touch the patient? It will shock you. And then there's nobody to help you. Because if this one wakes up and you collapse, he can't help you. That's why he said, do not touch the patient. So if you are doing it on a bed that has iron, don't even try it. That's why it's best if somebody collapses, put him on the floor. That bed with iron is dangerous because that iron, mistakenly you touch it, zzz, it will just go. Your normal rhythm will turn to abnormal rhythm. So that is what happens. All right? With the AED and by the. So after that, do not remove the destiny. Do not remove the parts. Constantly leave it there. It will now tell you if the rhythm has come back. It will now say stop resuscitation. If the rhythm does not come back, it will tell you continue CPR. So you continue. After 2 minutes, it will tell you, because I told you that all those things should be done within 2 minutes. After 2 minutes, automatically, it will tell you do not touch the patient. Analyzing rhythm. Do you understand? Automatically, every 2 minutes. Shock advice. Charging. Press the red button. Bah. So, what I can say is that there are shockable rhythms and there are non-shockable rhythms. So, if it's a non-shockable rhythm, it will just tell you continue CPR. But just know that a shockable rhythm can turn to non-shockable and vice versa. Am I communicating? So the machine will tell you, so just continue like that, all right, until help comes. Until help comes. This one, most of the time, if it's not an accident patient that has head injury, it's good to lift the head. They call it chin lift, head tilt, chin lift and head tilt. You can see the tongue in the first one. You can see the tongue is blocking that yellow. Do you see the yellow place? It's blocking the airway. So no matter what you're doing, the person is not breathing. The air is not entering. But if you do that chin lift, you can see the tongue has moved and the airway is clear. Did you see that? But if it's an accidented patient and he has suspected cervical, there's neck injury here. If you do that, you break, I don't know how to explain it in common man's language. you will cause more damage to the spinal cord. There's a professor who had injury. They picked him in a beetle, took him to UCH. But because of that thing, he was paralyzed from here down. And that thing wouldn't have happened because they now in a beetle, Volkswagen beetle. And you see this road safety. They always be talking about your expired tire. They don't want to learn CPR. All right. So the breathing, I've demonstrated the one of this, isn't it? But the breathing, you will ensure that your mouth covers the entire mouth of the victim. Not partial, full. Did you hear what I said? Your mouth should cover the entire mouth of the victim. And when you are blowing, ensure the whole air should go into that chest. There shouldn't be leakage. That means it should be a seal. So you have to be, that's why it's called kiss of life. Did you get what I'm trying to say? Then you blow. And as you are blowing, your eyes should see the chest. Is the chest rising? If the chest is not rising, you have not done anything. You can imagine that the head is like this, like that one. The air will not be going in. So the chest will not rise. So what you are doing is useless. That chest must rise. Did you hear what I said? Aha. Now, you can see that the person is pinching the nose. Why? So that the air does not escape through the nostrils. It should be going down to the what? To the lungs. Am I communicating? Now, what if he's a child trying to resuscitate his parent? Of course, his mouth cannot cover the entire mouth of the parent. So, youth fellowship, I can see you. That means we need to do BLS for them. You understand? Yeah? If he's a child and you cannot cover the entire mouth of the parent, you close the mouth and blow through the nose. Did you hear what I said? Close the mouth and what? Blow through the nose. So when you do that, you remove your mouth from there, allow air to come out. Then you deliver the second one, allow air to come out. Then if you're alone, you continue your CPR. After 32, like that. After more than 5 rounds, you check whether there is evidence of life. Because as a layman, you check whether he's beginning to breathe or something like that. All right? Well, this one is the chin lift and head tilt I was talking about, okay? This one, jaw thrust, I doubt whether laymen can do this one, but if they are medical people, Kagane. So there is next face shield. This face shield, is to avoid those of us that are afraid of contact with patient secretions. You can see that center. That center is not leatherish. Yeah. You can blow air through that small rectangular that's in the middle. So you put it across the face. Do you understand? Where that center will be at the mouth, where you can blow the air through it. But best, this one I got, it was so big, but there are smaller sizes. This one is supposed to be called the pocket mask that medical people will be going around with it. You can buy it. Can see it? Can be carrying it in your bag. You don't know. So you press it. So so that you don't make contact. Eh? I bought this one recently, 30K online. You can't buy life. Can you buy life? Abiola, he carried his wife for where she died. No, be so? You can't buy life. So you can get this. It's online. The church can even buy for us and we pay small. Not true now. All this one where they carry them go eat chicken or ask me. So this is a pocket mask. This one is supposed to be for medical people. Do I go ahead? This is the this one is for medical people. Maybe during the demonstration, I will show you because of time. I don't want to bore the non-medical people. Use of ambu bag. Reverend is around. Sir, we said something for our members meeting and lift up a hand. AED will buy, even if it's outside budget. And the members lifted their hand. We'll buy AED. Approved. You can see now, isn't it? You can see the hand encircling technique I was telling you. I told you I will show you the picture. For the infants, remember? Infants, I told you can use hand encircling method or 2 fingers. So if you are 2, you use this one. You can see that the person is like this. So the second person that will give the rescue will be at the head side. But if you are alone, you can't use hand because as you are by the feet before you turn and go to that side. No. Am I communicating? You will be by the side and you use 2 fingers. Okay, this one. The next please. Press again. Did you see that? Yeah, by the side using what? 2 fingers. 2 fingers. And you can see you're in the lower third. But you should be careful. Don't go too low. The liver of the children are always big and there. You can injure it. But you can see the bigger children, the one hand. Remember I told you this. So if you are alone, you do that. Generally, if you are alone, you use 30 to 2. But if you are 2, that's for children, you use 15 to 2. But since they are laymen, if you use 30 to 2, which I know that you will not forget, because so that you not say, children, did they say is 5 to 2? So I don't want that. So usually I just say, I beg. If you don't remember, if you do 30 to 2 and you are 2, it's still not bad. Why is that we shorten the one for children? Because most of the things that make them to have cardiac arrest is from respiratory, because they have small lungs. So their lungs cannot retain oxygen for 3 minutes as we're talking. They're on, in fact, some of the smaller babies, 20 seconds. If you're using that, you just see the saturation falling, P. So you cannot be saying you are doing 30. The oxygen is not there in the lungs. Am I communicating? So children, the time should be shorter. But unfortunately, if you're alone, you have to do 30 to 2. Am I communicating? All right. So if the person responds but is still unconscious, you put him in what we call the recovery position. Okay? Why? Because so that tongue will not fall back, and also he will not aspirate, and because if aspiration is, fluid will come out from the stomach and enter into the airway. And he's unconscious. Once something touches your vocal cords, you start coughing. But if he's unconscious, he won't know. It will enter and it will damage the lung. So you have saved the person, but his prognosis will be poorer. All right. So we talk about choking briefly. When somebody is choking, Usually we say, give him water. It's not correct. It's not correct. Hmm? Somebody is choking. Give him water is not correct. You can see why I say, let's do this thing sharp, sharp. I'm rushing these things. So, for adults, if you see somebody choking, ask him or her, Ma, sir, are you okay? He will note that he's okay. All right? But you advise him to stick around. Because once he can note that he's okay, and at least he can vocalize a bit, you know that it's mild, is a mild form of choking. Do you understand? It's mild obstruction. But if he's unable to note his head and say whether he's okay or not, and then nothing is coming out, no sound is coming out, that's severe obstruction. So the person that has mild, why I telling him to stick around is because it can progress from mild to severe. An example is always given where somebody was in a restaurant and said, "Sir, are you okay?" He said, he's okay. And then he went to the restroom, entered there, he changed from mild to severe and collapsed there and died. Because there was no help. He was in the restroom alone. Do you understand? So I would always advise those people to stick around. So if the person is mild, most of the time he'll be coughing. So encourage the person to cough, to keep coughing. Encourage him to what? Don't do anything. I see people trying to slap the back. No, that's not, you don't slap the back. When he's coughing, encourage him to keep coughing. Am I communicating? Encourage him to keep coughing. Huh? Now, if it's the severe type, because the severe can be in two forms. It can be severe, is conscious. It can be severe and is unconscious. That's worse, isn't it? Now, if it is severe but conscious, Elijah, so if it's severe and he's conscious, usually you see them, this is the universal sign, okay? So if he's severe and he's conscious, the Americans are saying that there's no need for even the back slaps, but the European resuscitation are still so that they're doing back slaps. So I'll teach both. So you will balance yourself. No, don't worry. You just be doing like this. Just be bending like, put here, 2 hands. You understand? So, me, I have to balance. Why? Because it can change from severe conscious to severe unconscious. And now if it becomes unconscious and you are not balanced, what happens? And then maybe you get head injury. So you have to balance as you are resuscitating. Don't stand anyhow. You put your hand on his belly, the heel of your hand between the scapulae. You know what is scapula? That big bone, 2 of them, in between. You hit it this way. Sorry, I'm going to hit you a little bit. So 1, 2, 3, 4, 5. But it will be stronger than this one. That force can. Then you knit your hand like this. You want to knit. You fold your hand this way. If you are a lefty, you can do this way. It doesn't matter. Me, I'm a righty. You put it in that triangle. You know, there's a triangle here where the epigastric region, we call it, but you put it. What you're going to do is, it's a circular movement. Eh? Hmm? You are balanced. 1, 2, 3. You are hitting the diaphragm so that it will create positive pressure to push that thing out. So you do it 5 times. If it's not out, you go back. 5, 5. You keep doing it. If it becomes unconscious, just pretend as if you have become unconscious. So what will happen? I will lie him down to the ground. And then once I lie him down, you start CPR. If it's unconscious, it's the normal CPR I've mentioned before. 32. 32. Am I there? Yes. That's what I'm saying. It's not right. I told you that it's wrong. It's wrong. It's wrong. So this is just a schematic this thing, okay? Remember, I just said mild and severe. Remember? Just show them the next. I've explained this one. Next. Hurry up. Hurry up. You see what I demonstrate? Oh, okay. Yes. Where are you now? As if you have jumped some, isn't it? You jumped some? You jumped some more. Go back. Go back. Go back. Aha. This no. Yes. You can see that some of us have daddy or mommy, yes. Carry brought forward. You treat them like the pregnant woman. You cannot be doing that stomach thing. You do it on the chest. You can see the hand is on the chest. Do you understand? You do it where? On the chest. Did you see that? All right. Next. Next. It's just pictorial. I told you if it's unconscious CPR, isn't it? Now, if you are alone, and you are choking and you are conscious, you can see, get a seat, put your hand at that top, and be hitting the chair with it. Use your weight to be hitting the chair with it. Can you see it? Can you see it if you're alone? They call it self-resuscitation. Now, I didn't put the picture for that of children, mostly because I was thinking of time. I don't know. Do I talk about the children? You have a baby here. Baby. Oh, no, baby. When I say infant, not child. I say I make definition. Not child, baby. Suckling baby. Not even a neonate. Suckling. See? Oh, that one is a child, it's not a baby. But let him come. Usually, if it's a child, instead of standing, you will kneel so that you'll be at the same height. If it's a child. But I'm talking about infant now. Boy, how are you? You're sleeping and I woke you up. Stand here, stand, because you will cry. Because I'm going to. See, ba? If it's like this, you put him on your lap. Hmm? Hmm? You put him down like this, with his head going down. Hmm? They use 2 fingers. Do that 5. You turn him like this. Usually this leg's supposed to cross like this. Then you go in between that shoulder. Bang, 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 bang. 5 times. If it doesn't come out, repeat. Is it clear? Is it clear? All right. Thank you. Now, we are spirit men. As you are doing this, be praying. Be praying. Let me talk about my missionary work. Even unconscious people, I preach to them. Because me, I was once conscious. I was hearing what people were saying. I was hearing. They didn't know I was hearing, even though I was unconscious. So I was assaulted and I was unconscious. So if I see an unconscious patient, I still preach to them. I say, I know you can hear me. If you have not received Christ, receive Jesus Christ. In the name of Jesus. So don't see somebody unconscious and say, don't preach. Preach. Did you hear what I said? And then this story I'm giving, I read it, I saw it on Christian Broadcasting Network, CBN. He was giving testimony. He said he was doing this, their cowboy thing. This is not the real picture, I'm just putting it. He fell from the distance and the thing trampled upon him and he died. So they were doing the resuscitation and the wife called people, say, pray. So he said that as they were praying, that he was seeing bolts of fire coming from heaven. That's what he was seeing. As they were praying, bolts of fire were coming. Bolts of fire were coming. When one of the fires just touched him, boom, he just woke up. So is it our resuscitation or the prayer? Or the two, both of them? So as you do it, be praying. Am I communicating? Be praying. Prayer is very, very important. So when do you stop? When helps arrive? Or when you get exhausted? There's one of our doctors, if I mention the story exactly, people will know who he is, but I won't mention the story exactly. But he too was assaulted. We did that resuscitation 2 hours. Everybody was exhausted until his brain matter started coming out. We had to stop. So we were exhausted after 2 hours. So there's no time to say, let nobody say, you should resuscitate for so time. No. So you can see these 2 footballers. One of them is Patrice Muamba. Then the one is Eriksen, Christian Eriksen. These 2 footballers had cardiac arrest and they were resuscitated for more than 80 minutes. And both of them were lucky that there was a cardiologist in the field. They were lucky. So because that early, that's why we're here. Because that issue of carry him to Jude is the one that is killing us. Because before he reached Jude, his dead body. That initial resuscitation, that's what saved them. And the resuscitation went on for more than 80 minutes. And they are alive up to today. In fact, Eriksen is playing football again because they put a cardiac pacemaker for him. They put a pacemaker. So he's even playing the white man down. But the other one had to stop playing ball. Muamba. All right? So there's no time to say you stop at so. Next, well, I'm finishing because of time. Remember, this is my picture. Who remembers? Next. Who remembers this is my picture? Nobody remembers? Okay, people know they come for Wednesday prayers, so they don't remember. I use this in one of the Wednesday prayers. This man and his grandfather, they used to go and he wanted to snap this bird called the kingfisher. At the point that the bird is striking the water, the grandfather died, he couldn't achieve it. So he continued. And he took 420,000 photos. That's almost 1 million pictures, just to get this shot. So when you talk about resuscitation, it's about tenacity and the never give up spirit. You have forgotten this picture. Badamwa. Thank him for you. I say thank him for you, I don't pity. Questions were going on when we were, this is a brief summary. All this way I say is summary. The book is like this. Questions. I know people were asking any other questions. Yes, ma. Don't be confused.
All right.
Our God is not a God of confusion.
Okay. So how do I tell if the person is already dead or unconscious?
You came late.
Yes.
You can see I can assess. My spirit is working. I said that for laymen, you should check for responsiveness. If it's not responsive, start resuscitation. Sir, that's vocal. Are you okay? Are you okay? It's not. Are you okay? It's not moving. He's still. You don't check pulse because you are not trained to do that. Once you see he's not breathing, he's not responding, start resuscitation. Is it clear? It's not clear. You are not convinced. So, just do what I told you, and that is, you see, they've done this as I see. This thing is a meeting of medical doctors involved in resuscitation. They call it ILCO, International Liaison Committee on Resuscitation. So it's not something that somebody just imagined. That is what they have experimented and said this is what laymen should do. If the person should be not responsive, what I've demonstrated now, until help comes. Is it clear? It's not an imagination, because what are they do? Any other question, please? So that I'll do the demonstration sharp, then we'll start. Yes, ma'am. You can see it's 12 o'clock. Let's start this thing early.
Thank you, sir. I want to ask for maybe advice what we can do because sometimes the situation has not reached that of unconsciousness, but because of some carelessness, it can get there. Some weeks back, we had a situation in my office in the morning. We were praying, then a student collapsed in the class. And while we were there, suddenly the lecturer came in, and then with some students carrying her. And that they brought her that we should pray for her. So we came out, and then when I came out, everybody, it seemed nobody knew what to do. They were going to start praying. But when I just looked at her, she was partially unconscious. She was partly conscious. So based on my discussions with my daughter, psychologists, and all of that, so I just started talking, trying to get her alert. So I kept calling. I didn't know her name, so I was just calling her. Can you hear me? Can you hear me? I kept talking. But at the long run, we took her to the clinic. And the situation was that she took diazepam overdose and then did not sleep. So when she came to class, she collapsed. So when we went to the clinic, at the end of the day, they just sent her back home. Nothing was done to her, but I was afraid that it could become more complicated. So my question is, especially for those of us who deal with a lot of these people, young people, so how do you help, like in a situation like that, so that, because you can be a little careless, and I think the line is very thin, and it gets worsened. Thank you.
Yes. Most of the time, if somebody is in such state, it's better to lie him down flat and ensure that, remember that chin lift, so that ensure that he's breathing well. That's best, because as he's lying down flat, even if it's lack of blood going to the brain, at least blood will go there. So don't be rushing the person anywhere. Place the person where there's, is in the class, take him out to the corridor where there's air. Put the person flat. And even if you touch the pulse, if you're a medical, you see the pulse improving most of the time. The commonest things that happened is those things, as I said. Since you're a department, it will be good to buy those 2 antidotes. The one for diazepam is called flumazenil. You can, it can expire on you, but at least you would have saved life if it was available. So if you buy naloxone, you buy flumazenil, and keep, because if you give flumazenil, it will reverse those diazepam effects. Do you understand? And then most of as I said, most of the time, if you put the patient, the victim, whatever, flat, and he gets good oxygenation and good blood supply to the brain, they usually come back. So I think that's the best you can do. There's nothing as a layman that you can do apart from that. Yes, you know that I'm sure they don't have flumazenil in the yeah. Because what happens is that diazepam, as I said, it depresses respiration. So probably she collapsed because of hypoxia, lack of oxygen. And you don't have oxygen in the. So you see, if where things work, there should be a small place within the faculty where there's oxygen, there's a nurse. You understand? But because if they gave her oxygen, she will jump up. Do you understand? Yes, ma. The lecturers are asking questions. There's one lecturer there.
Good afternoon. So I want to ask, I've heard about, I just want to be sure that what I'm hearing is true. I was told that if somebody goes into something like cardiac or whatever, or is having one of those
Cardiac
challenges,
arrest.
you can there's a place for aspirin. Is it aspirin under the tongue or aspirin in the mouth? I don't know whether it's a myth or there's a place for its use, because I was told that it can help immediately with either stabilizing or, saving the person at that point in time. Then secondly, I've also seen on, social media, that if somebody is in cardiac, you can be hitting the inner palm and just hitting it till it can also help with resuscitation. I don't know if you can clear that for me.
See cardiologist in front of you. Is it true that you go hit the hand, it will help with resuscitation?
I don't know about that. Okay, I don't know about that, what you saw. But there's difference between cardiac arrest and heart attack.
Mm-hmm.
So the one about aspirin is for heart attack. That's what we call a myocardial infarction. Mm. So when people have heart attack, they can put 4 tablets of aspirin, or they can just chew it. It helps with the pain, and it helps with the perfusion. Because most times when people have heart attack is that there's like an occlusion to the blood vessel supplying the heart. So when you give aspirin, it tends to help and give some form of relief, but that's not the major treatment. You still have to rush the person to the hospital.
What? Wait. What is trying to say? Cardiac arrest, the heart has stopped. No aspirin is going to help. What is blood that carries the drug to its target. This. If there's no blood movement, what will carry the aspirin to the heart? So cardiac arrest, the heart has stopped. So this most of the other cardiac a heart attack, there's myocardial and many other things. The heart is still beating, but abnormally. So, but that's heart attack. Do you understand now? But when it's cardiac arrest, nothing. You must do that one. MUST, must. Yes, sir. There's Baba there. So you can see we have not even started the practical. Maybe we hurry. They say they do sugar.
Yes, I want to know what are the triggers for cardiac arrest?
There's somebody there. So let me be answering while you are taking it to the personal part. Usually, let me just give a broad sum. We have cardiovascular diseases. The person might have heart diseases, including hypertension and the rest. You can have respiratory, that is from the lungs or anything to do with breathing. Because I don't want to talk in the medical. I have cut all those ones out of my presentation because they are not medical people. Do you understand what I'm saying? Then it can be from drowning. It can be from drug effects, anaphylaxis. It can be from blood loss, accident. It can be from water loss, vomiting, diarrhea. You understand? Then, of course, it can be from drugs, which I've explained. That one is indirect because it's not directly on the heart. It's the effect of on the brain. That's the Valium and the other drugs. All right? So these are the categories. You divide them into, Of course, another common thing that makes people collapse is metabolic, and the metabolic involves things like sugar. Let's say, yes, a diabetic, for example, did not eat and he took his drug. It will wipe away the sugar. We had a patient like that up to now, I've not recovered. This is 20 years, but anytime it pains me. This is a man that the sugar was normal. But we did the surgery and told the man, okay, you should eat. And when he eats, you take your drugs and you eat. Unfortunately, when he ate, he vomited the food. And the nurse did not notice. She didn't notice. So the drug he took wiped away the sugar. By the time we arrived, his sugar was, the normal in millimoles, is 5.5. His own was 1. And he passed on. This is a man that trained in Britain. You can still hear his British English. The man died. Anyway, that's by the way. But I hope you got the gist. Yes, sir. So those are the things.
Okay, good afternoon.
Sorry.
Yeah, mine is about when you made mention of when somebody is choking, and then usually in the community now, in the society, it's well known that if somebody is choking, you give them water. But just like you mentioned now, you said we shouldn't give the person water. We should allow the person to continue coughing. So I want to know, what does the water do if you give that person water when he's choking? And secondly, in the process of maybe somebody swallowed something and is resulting to choking, and then the person gets unconscious, So you said we should lay the person down on continual resuscitation, right? So I want to know, how does that particular substance go out? Or during that resuscitation, and then you are doing 30 to 2, won't you push, when you are blowing the air now, won't you push that thing inside further? That's the question I have.
Yeah, I've been asked that question several times because I've been doing this for more than 20 years now. But you see, the issue is, remember I was telling you that the Heimlich maneuver and the heating is to increase the pressure within the cardiothoracic, within the thoracic cavity. So even there are two mechanisms. I only mentioned one because of time. When you are doing that compression, number one is that it's squeezing blood out of the heart, which I've mentioned. But secondly, it also develops positive pressure within the thoracic cavity. And that positive pressure pushes blood out of the heart. So there are two mechanisms. So that positive pressure should push that foreign body out of the airway. Is it clear now? So the water you are giving, or usually when something touches, let me give you an example now. When somebody drowns, that's how they know that he was pushed in dead or he was alive when he was pushed inside the water. Usually, people who drown and die, they don't die from water in the lung. They die from asphyxiation. What do I mean? The vocal cords was as anything that touches it, it will close. So that no water will, that's the safety mechanism, so that water does not go into the lungs. Now something is already irritating the vocal cords, and you are now putting water on top again. Kagari, you are worsening the situation. You are making the thing to close the move. You are not supposed to. Though there are sometimes that the irritation may be maybe borokono within the throat, not the air pipe, the windpipe. And that one, it can suit the borokono there, that water. But it's not for the airway. If it's for the airway, water is not correct. Kagari? All right. No, he wanted to say something. Sorry, I'm following. Should we put a cap on these questions? Because it's already past 12.
Yes, my own is in line with the air passage. I'm trying to look at a situation where there's a fire outbreak and then somebody inhale smoke. You understand? Because you have not mentioned it. So how do you go about it? Is it the same process that you go about it, or how do you go about that?
Who is the next person? Anyway, you see, the issue of fire, most of the time is carbon monoxide. And then we also have soot. You understand? So, unfortunately, we don't have oxygen readily available, because carbon monoxide binds to the oxygen more than 200 times than oxygen. So it displaces oxygen. You see the person normal. In fact, even when you put that this in, the thing might be really normal, because the carboxyhemoglobin, which is from carbon monoxide, is similar to the oxyhemoglobin. That's the attachment of hemoglobin to oxygen. You understand? So the person is dying quietly. That's why silently they will just die. Do you understand? So in such situations, there's no oxygen. It's good to just put it in the air. It happened to us I remember, 1994. Who remembers? Jos was extremely cold. Who remembers? Very cold. So some guys were coming from Kabwir, including one of my brothers. You know me, I'm from Orumba South, Anambra State. So one of my brothers was also in the car. He was at the back of the station wagon. not knowing that some smoke from the exhaust was entering inside. By the time they reached Berkeley Ladi, the 3 passengers at the back became unconscious. Carbon monoxide. So they rushed them to Plateau Hospital. I happened to be there. So what happened? We don't have oxygen that time. I tell you, the hospital, we didn't have oxygen. So we just put them in the air. It will take longer. If it was oxygen, the thing will shorten. But since they were still alive, we just tried to do the what is called ABCD of resuscitation. And we gave them, gave them drugs, an IV fluid. After a while, they became conscious. My brother from Anambra State, immediately he woke up, he was actually coming to buy goods. He just said, "Where's my money? Where's my money?" I'm serious. I'm not exaggerating. I'm just telling you life story. Life story. He's my brother. I'm from Orumba South. So of course, if you try and bring them to the hospital, because oxygen will reduce the lifespan of that carbon monoxide. And then that suit, they will try to suction that suit out also. That's the only way. But as a layman, the best you can do is to put them in the air. The barb is okay. Take them away from that. Because carbon dioxide does not smell. It's odorless. You just die quietly. So take them away from that environment completely, far away from that fire. That's the best you can do. Then take them to the hospital. Somebody, I think that will be the last question. If not, we'll not finish. Huh?
Okay, sir. Sorry, my questions is to piggyback on what Jane was asking. If the person is gone or this thing. I didn't hear you talk about checking for pulse.
The man
before.
Came late. The man came late.
No, I was
diagnosis.
Here. Okay.
Spot
because if
diagnosis.
the person is not responsive, there can still be a pulse that you give CPR. But if there's no pulse, maybe the person has gone. That's one. Then number 2, we're taught that in the case of drowning, when you do the compression and the person revives, you turn the person to the left, on his left side, so that you have airways. So with normal passing out and you do that, is there like a post thing? Do you keep the person seated up if it's not drowning and stuff?
Okay. You were talking about, I told you that this thing has been researched. And you see, because time is of the essence. The longer you wait, and I told you the brain, it takes 3 to 5 minutes. And you, look, I've done this presentation to medical staff, and I'll tell them, can you touch the carotid for me? They fumble. These are medical staff. Now you are a layman, you are looking for carotid. You are wasting time and the person is dying. So that's why they say, laymen, don't look for carotid. Go straight and resuscitate. Once he's not responsive, he's not breathing, just go. You will not falter if you do that. That's why they say that. Because I've told you several times, I get 5/100. I'm serious. Medical staff who are supposed to know where the carotid is, they don't know. You understand? So you see, time is of the essence. We can't be wasting time looking for carotid and the person is dying. Then the second thing he said is what? They lined down. Yes, I said that if you resuscitate somebody and he is unconscious, that's when you lie him down. Because the issue is that he might aspirate, because the vocal cords will not do what I explained there, because he's unconscious. It's usually conscious people that the vocal cords will close when anything touches it. But if he's unconscious, quietly fluid from the stomach can enter the airway without him knowing, because he's unconscious. You understand? That's why we do the recovery position. Okay? The drowning is because of time. Drowning is more of respiratory problem. So if you see somebody drowning, the first thing you do is not cardiac compression. the first thing you do is to give 5 rescue breaths first, because it's more of respiration before you start. There's no time. I tell you, there's no time. You give 5 rescue breaths first before you start, because it's more of respiratory. Then you do that. Once you do that, try to keep the person warm and all that, because from water. If he's unconscious, but if he's conscious, there's nothing that can touch his airway and then he will not react. It's only when he's unconscious you put him in that recovery position. Is it clear now? So I beg questions. You can approach the bench.
One more here, sir. Sorry. Quickly.
Oh, okay, Josh.
The aspect of someone biting on the tongue or the jaw, locking the tongue. How can we respond to that?
You see, we're talking. No. Let me say something. We just talked about heart attack and cardiac arrest. Cardiac arrest, the person is dead. There's no way you are dead and you are biting your tongue. It's not possible. By what means? Is it by witchcraft? You cannot be dead and be biting your tongue. So we're talking about cardiac arrest now. Anybody biting his tongue is alive. I hope you understand what I'm saying. So it's not. He might be convulsing. He might be having other things. But if you are dead, your mouth will be open. Cardiac arrest, you are dead. Have I answered the question? Thank you. God bless you. So, I have with me some of my people from my department, not in any order. Dr. Divine. Stand up now, may they see you. He's a consultant with us. He's always in the ICU. So don't go to his place. ICU is not good. Yes, we have Dr. Solomon Obinwani. Did I pronounce it correct? I'm from Orumba South, but I can't pronounce the name very well. Then our own dear Dr. Aboki. We also have our own dear Akuse Kasai, Ni Nyako. Then we have our technician, Evelyn Dongs. So they're here, they will help us. I'll just demonstrate. Oh, there's somebody else. Oh, Dr. Mark Sylvester is a senior registrar with us also. Thank you. Sorry. So, who came again? Ralph is a nurse anesthetist with us also. So they're here to help us. I'll only do the demonstration, then we'll divide ourselves. They will help to put you through. Ensure that you do the thing. Because, as I said, all this training will be useless if you are not doing this thing effectively. We have not come here to do Asayara. It's serious business. If you are not ready, don't. We want to be sure that you are doing the right thing. That's why we say that at least we should have not more than 10 people per person. Because the ideal is even 6. So that you do it several times, until you get used to it. I don't want to mention the name of the sister. She did that in like 2017. When the thing, every 2 years actually, you're supposed to refresh yourself. So when the thing happened, after about, I think 10 years, she had not gone back. She became confused, ran and carried key and was confused. She didn't know what to do again. She had done the training, but she had not rehearsed again. Every 2 years, you must do that rehearsal. You must do it again. She was confused and carried key and left the victim there. She didn't do anything. By the time she came back, the person was dead. That's why I said, know what to that first. Don't get confused. Breathe in and say, Holy Spirit, help me. Amen. I don't know whether people will, I don't know, because you need to see what I'm doing. I don't know whether people will be able to see. Oh, there's a screen. Okay. All right. So, no, on the floor is better. So, no. So, this is, the Americans will call an unidentified person John Doe. So this is John Doe. This is John Doe, and John Doe, I saw him at this Lamingo runabout, the runabout before Plateau Church. All right? So, and I'll check for my own safety because I don't know what hit him. Is it electrical cable? Is it a wild? I don't know. Now I've checked and it's safe. Then, since I don't know his name, sir, are you okay? Sir, are you okay? I can see he's motionless. He's not breathing. He's not breathing. Because if he's breathing, at least I can see. So I'll tap him. Sir, are you okay? Sir, are you okay? Help, help. Somebody has a cardiac arrest. That's a layman. He didn't touch the pulse, but that's the algorithm. Huh? Help, help. Somebody has cardiac arrest. In sane places, you said, activate the emergency system and get me an AED. Huh? So the person there, will call. But I forgot to say that, because of pressure of time, the way you use social media for good is not Facebook, it's WhatsApp. Since we don't have 999, it's not working. My friend is a doctor of cockroaches and rats. He can now send me a WhatsApp message that he saw somebody since I'm in Jude, can I come? Do you understand? And I can easily come. So that's another thing that I should have said that I didn't say. So it's not as if the social media is completely bad, but it shouldn't be Facebook, where everybody is seeing. But at least your group, if you know people who know how to do resources, you can post it to your group. Of course, my own is very clear. Everybody knows how to do resuscitation. So immediately I post it to my own group, somebody will jump. Do you understand? Because if you send it to me, if I'm not around, for example, I'm in Lagos, I can forward it to my group that somebody has cardiac arrest and they can easily come to help instead of 999. So that is that. So the person, assuming there's nobody to help, so I will have to kneel beside the person. I'm doing like a layman, so I'm not checking. See his nipples. I'm one finger just below the imaginary line. Look at my hands. Because we see people doing like this. Let me stand up so that people will see. It's not like that. Your hand will be straight. It is your body you use. Your hand will be straight. Not, you get more tired. No, your hand will be straight. Are you seeing what I'm doing? So, and then some people say you shouldn't count, but me, I believe you should count. Because even if you're counting money, you're counting it silently. You say 19, 18, 17, 20. You make mistakes, but if you're counting loud, And the second reason why you count loud is that if help finally comes and hears you say 25, he knows that in the next 5 compressions, he should deliver the rescue breath. That's my own belief. So it's good to count out loud, not in your heart. One of us do and zuchi in a Pentecostal prayer. All right, are we there? So you count out loud, and I told you that every half second. So it's really fast. And because this is a mannequin, you hear, even the click sound from this one, don't spoil yourself. Suppose you hear a click sound. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Chain lived. Let me use my. I'm using this, okay? Okay? Chin lived, head tilted. I'm pinching the nose. I'm going to cover the mouth. Can you see the lift? Can you see the chest rising? As I'm blowing my eyes, is looking at the 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. That first one was not good, huh? That's what you do 5 times. You see responding is the breath back because you can't be saying you're checking pulse. It's not, then you continue. Have you seen it? You have seen it. Are we ready? I say, yeah. Are we ready? Are we ready? Let's hit the ball rolling. Let's go, my friends. Come. So let's count. How many are we? How many are we? 8. 80, go. 80. 10. Okay, let's start counting. 1 to 10. One to 10. Start, ma. 1.
5.
1.
5.
Did we? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. Huh? What's that your name again? Is this? What's that your name again? Are you going to do it? Aboki's son. Is this Salama? What's that your name again? Albarka. Are you going to do it too? You're afraid. So 10. Okay. 1. 2, 3. I've counted you. 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7. Anybody with that number? 8. 8. 9. Who else? Pamela, 10. 1. So, 1, come here. 2, come here. 3, go there. 4, go to that place, that passage. 5, come here. 5, here, 5. 6, come here. 6, come here. How many decent do we have? If you like say don't go Oko, the mannequins, how many do we have? They're not up to 10 now. Huh? How many do we have? 5. Only? Sure. You know go walk safe. So if you like say 1 and 2. How many, sir? Hello? Hello? Where is 10? 10. Join these 2 here. Because the number of mannequins is so that I know. Join them. 10. Join them. 3. Where? 3. Eh? I say you should be here, huh? That open place. I saw the mat. Somebody brought a mat. 6. Don't go there again. The mannequins are only 5. I thought they were 10. 6, just join them. 6 and 3. 6 and 3. 2 and 10. 1 and 2. No, you are the one that is 2. 2 and 10. Which number have not allocated? 7. Go and join 1 then. 7. Go and join 1. The mannequins are few. I thought they were. Let me just. This you are number 3 and what? Only 3 and 6. 6. I want because there are only 5 mannequins, so I want to match. So now this is 6. 1 and 7. 4 and 8. 4 and 8.
9 and what?
So remaining 9.
5.
Where is 5? 5 and 9. 5 and 9 there. Towards that. Because we have to be far away, because as somebody is counting 1, 2, 3, be confusing the next person. That's why I'm trying to put us far away. Everybody must do it too. Everybody.
5 and 9 where? That's serious.
No, you must.
5 and 9 where?
5 and 9 here. No. There. That.
Each person can pump for 30. Each person can do chest compression for 30.
Yes.
For 20 years.
And that's what I'm doing now.
Yeah, you can do it in a short time.
Yes. So, take it to the groups. Take it to this group. Take it to that group there. Where is the... It's Amubak. Anyway, those medical people. There's something I'm looking for. Huh? No, wait. Where are you taking that one to?
This one here.
This one, uncle? That group, they don't have. No. Take it there. This is not go do. No go do. You no go do. You no go do. I didn't know. I bought only one packet for. I have to go and. I bought only one packet. So, sharing bar. When when you have gas, you not have that one now. You have to do the. Yes, share it. Now, go to those people there.
Okay.
Two of you. Divine, stay here now. You and I have to go. You stay with Divine here. How many of us? We're 8.
Yes, sir.
And I've already shared 4.
Yes, yes, sir. The remaining, myself, Kasai, Aboki. There is 7.
No, plus me is 8
Plus
now.
you, yes, sir.
Who is here? Nobody.
Yes, sir.
Kasai, can you handle it alone? Can you? Say, can you, mana? Are you there? Go with them. Go with them. You go there.
Okay, sir.
Is there anybody there?
Don't think so.
I will get more.
Okay.
Elijah. I didn't know that.
Okay.
You have another but maybe I put it on again.
Oh,
When I always not the ones I brought. I brought. What's going on? So, thank you very much. If we're through, thank you very much. Whatever you see the master do, put it into practice. Huh? And the Lord God Almighty will bless you. So we're dismissed. The Lord bless and keep you. The Lord make his face shine upon you and grant you his peace. Shalom. Yes, sir.